Hey, it's Steve again from the Virginia Beach area, making a video about my minimally invasive MIS TLIF multi-level fusion of my S1, L5, and L4. The operation I had was on February 16th of 2023, and I'm making some videos. I did one on, the post-op and the actual surgery itself, one on the backstory, and also on key elements that I felt helped me along the way with the post-op. But I wanted to do one also with the pre-op because I thought I did one and it seems like I can't find it. So that's what this one's about. You want to get the backstory and all that, just check out the other ones. But with the pre-op, I first want to give credit to Dr. Mitchell, because I didn't say that in my backstory video. He was the one, the neurosurgeon that my orthopedic surgeon finally sent me to. That was the one that found why things didn't work for the whole 2 years after the accident. And, I did ask for a second opinion, and he was that cool of a doctor that, he also recommended me to the surgeon that I actually went with, Dr. Vincent. And not because I liked, well, it was mainly because minimally invasive versus the traditional TLIF. And I'm one that I would highly recommend doing the minimally invasive because it's less scar tissue potential, less ligament and muscle damage. So anyhow, I want to talk about what I did pre-op that really helped, in my opinion, my post-op and my recovery up to this point, which has been just going, I'm nervous to say it, but it has been going fantastic. I've had a couple bad days in the 2 weeks, but I don't think it could have gone much better. Everything has been completely manageable. So I'm gonna start, let me grab this, sorry. The first thing was study this. When you make that decision to do it, they're gonna give you this book, it's about 70 pages. And this has so much information in it if you take your time that you can build on to get yourself prepped up for what's gonna happen before, middle, and after. So that's the first thing. Really take your time to go over that book. Another thing is, make sure you try to get your body into as best shape you can do or you can get in. I was, even with the injury I had prior, I was very active doing things around the house, the pool. Fortunately, we have a saltwater pool that's going to kick in later to help with the therapy. But, just maintaining that, yard work, housework, stuff that I can do because I was limited, because I had 2 bilateral fractures on my disc. But just staying active and getting your body up to par. There's exercises that you'll get in the handbook that I highly recommend. One is like being able to do, tricep lifts from a seated position or a chair and pushing yourself up. Get your triceps stronger in your upper body because you're going to be doing that quite a bit. You can't bend over. So try to get your upper body strength up, your legs, your squatting strength. Practice doing what you have to do post-op now or pre-op, like your log rolls. Practice not bending, practice not twisting, practice squatting to pick things up, practice kneeling down to pick up a broom or something, in case you drop something and you don't have a grabber. Practice all these things before you get to the surgery, because I promise you it will pay off, as it really helped me in my confidence, like getting in and out of the car, knowing how to do that properly. I was confident with that after surgery, and it really helped instead of trying to learn it then when you're in so much pain. So go over that stuff, all these little lessons that you need before you actually get to the surgery. Do the walks. I mapped out some walks, and I was walking. They want you to walk before surgery. So I was mapping out the walks and getting my own personal gauges of how long it took, how it felt, being very body conscious of what the disc felt like prior. you know, the step strides, all this stuff, so that I can have a gauge for what it would feel like when I'm taking these walks, building up to it again. You don't get that type of information from anyone. So you're going to have to try to, well, for me, that's the information that gave me a gauge, because I don't know what the surgery feels like. And who's going to tell you that? You know, your body has to tell you that. And I can tell you now, the walks that I'm doing now, which is the similar ones that I did prior to surgery, it's amazing of the difference already. Like, I knew I was going to get surgery on my last walk before surgery, when I was walking around the corner and I literally just felt like I was going to fall down. No stability in my spine. It was completely crushed. Numbness, nerve, weakness, nothing firing. And I'm now doing that walk pain-free as far as any of that's concerned. I have surgery pain and the nerves relearning things, but all of that is gone. And I'm so grateful for that, guys. Trust. So just do the stuff beforehand. Do your walks, do your paths. Let's see what else we got. Nutrition. Just try to clean yourself up. You know, I stopped doing the supplements. They're going to make you do that anyway. Stop doing the supplements, and start calming down on like the ibuprofens and all that stuff. I did that because I wanted a clean slate when I knew the narcotics and all that stuff was going to come in. I felt it would be best to have a clean start with it, so that I can get the most effective, the most potency out of what I was going to use to help with the healing, because you're going to need to be on that pain management. It's just no way around it. It might be minimally invasive, but what they did, 6 screws, 2 rods, inserting implants, opening your spine up, you're going to feel that. So the better your nutrition is, it's going to help you with your constipation, because you're going to get constipated, or most do, you know, with the meds and all that. And just having your body tuned up. The more tuned and strong, or muscle strength you have, calcium, different things that make your bones strong, the better it's going to serve you post-op. And then another thing that's underrated, and I had to find this out, and I need to do it again, is breathing. Like, the breathing helps like you wouldn't believe. And because of how much pain I've been in, and I'm sure you're in, how much you're just holding on all the time, and you're gonna get to a point where you're not breathing, you're shallow breathing, and you're not really getting that air in. So breathing is a huge thing, I would say, to just start doing. Now, house prep. That's another big thing that Emmanuel kind of says, you know, get some chairs. I noticed in evaluating the house, we didn't have any chairs with the arm rails on it. Something that you can push up, because you're not going to really be able to do that too well sitting from a chair with no armrest, or trying to get out of the recliner, especially if it's like leaning back. You're going to really put a lot of strain on that hardware, especially at any level. But you want to make sure you have something that you can sit in, like I'm sitting in this chair now for this video, and my hands are here, and that's where the rest is. Chairs, grabber tools, anything that you can help to pick up stuff, just whatever to make life easier. You know, sometimes you got the sock pulls and all that stuff. Another key thing is move stuff that's on the bottom up. So my sock drawer, underwear drawer, that was all on the bottom. So the wife and I, we changed drawers and we switched everything up, so I don't have to bend. Pots, pans, spoons, make things easily accessible, but higher. You know, right around, like all my stuff in the pantry, I moved it up to my level. Let the kids bend down and pick up stuff. I need it up here. So just kind of rearrange your house a little bit. Throw rugs, anything that can hook up and make you trip. Because I'm telling you, my daughter almost fell out of the chair standing up, and I instinctively reacted. And I thought that was probably one of the worst pains I've had in the 2 weeks. It felt like somebody just punched you in the back of that movement. So you don't want anything that's going to trip you up. Watch the dogs or cats or whatever, you know, kind of get them. If they like to be all up under you, you might want to kind of keep an eye out, you know, just be aware. So just go through your house and check out things that could be a hazard. Your pathways is cleared. I know from on my side of the bed, I moved this nightstand and this thing that I had so that I had a clear shot straight to my bathroom instead of having to navigate around stuff, especially at night. Night lights on, plug in night lights or whatever so you can see. Just get your path clear. Meal preps. We also prepped a lot of meals ahead of time and vacuum sealed them, just to make it easier on the wife because she's going to be she picked up a lot of the extra load of things. I was the cook and, did a lot of things, but she's going to have to do that. So if she can come home and then you can have a nice meal already set in a baggie and all she has to do is just put it in warm water, or I can even do that. It helps her out. And it was also for me when she returns back to work, if I need something to eat, I have my ham and whatever in sealed bags and I can just put it in water, thaw it out, and now I can make sandwiches or something that I don't require a lot of bending and everything. So meal prep is really good. Let's see. We also got our kids to kind of understand and been very transparent that this is going to be an adjustment for all of us. So just be prepared for it. And, it's serious what we have to be careful with, especially the top. We have a 3-year-old and a 15-year-old. And the 3-year-old, I showed her my scar, she likes to crawl in the bed and do this and that, but she had to understand that she's going to have to be careful. Daddy's hurting. So I say just be upfront with the kids about it, so that they're not blindsided because it's going to be a shock to them as well. Let's see, neighbors or family or whoever you have around, because you're going to need the help, especially in the first 2 weeks. Doing it on your own, you're going to risk a lot of things if you try to do this all on your own. Fortunately, I have a wife, and when we have neighbors around that can help out with heavy things, or if we need to have something moved, or if I need a recliner chair to come in here or whatever, I have good neighbors that are ready to help out. And I won't hesitate to ask. So many people say, let me know if you need anything. Well, don't hesitate on it, because a lot of times people say that, and sometimes you just need to call them out on it if it's going to help you. So don't hesitate to help, but get some care set up. And I also taught my wife about some of the things like the pool prep. If it rains, we need to go ahead and how to put the sump pump in to drain it down, because we have a saltwater pool. We don't have to cover it, but you don't want it running over. So, just maintenance things around the house, how to cut the grass, because I take a lot of care in our grass and been prepping it, and it's going to be time for it to start coming out. So, making it easier for her, but showing her, what to do with all that. It's a lot more than she imagined. So help the wife understand those things so that you're not ripping her head off if she's doing something wrong and you're at each other. And these last few things is just the mental side. For me, just coming to terms with everything, like the pain levels that I'm in prior, and knowing that, yes, you're going to be in pain post, but that pain is a new pain. You've been living with this old, deep, hard pain for so long. Your pain tolerance is probably a little bit higher than you think. This new pain is a surgery pain, an irritation pain from the nerves and things like that, but it's acute. It's a now pain, and it gets better every day, especially if you're moving and you're following all the protocol. It really does get better each day, just listening to your body. Just get your mind wrapped around the fact that pain is only going to be temporary, a week or two, and then you're going to be on your way to feeling amazing, because I was feeling amazing pretty much right away. And I don't know if that's common or not, so I can just go off of what I'm doing and share with you that I believe it's just a very good success so far. And just mentally prepare yourself before it so that it can carry over afterwards. And also, and lastly, I'll leave with this, just be prepared to adjust, because there's a lot of things I've learned being in the now with it that, it's not in the manual or anything. Like, for instance, if I had a visitor, Is it best to have visitors early in the game? Because a lot of times the visitor is going to make you, they're going to want to sit up and talk with you and try to make you feel comfortable and take your mind off of everything, but you might be sitting up too long. And that, what I found that happened to me, I sat up for like over an hour, and it put me in a situation where I had to lay down for the rest of the day. So just be prepared to make adjustments. Sometimes this works. Sometimes you learn a limit there. Sometimes you go, no, I could have done a little bit more, or I could have done a little bit less. It's all new to all of us, and every person is different with it. So listen to your body, be prepared to adjust, reach out to your care team. Just, I reached out to them if I had a question about something. Sometimes you might feel the hardware or a sting, or I haven't pooped yet or whatever. So just be ready to just be adaptable, because it's a whole new lifestyle that you're about to take on. And I think it can be very positive with the right diagnosis and everything. This multi-level fusion seems like it was meant for what I needed, and it's doing the job, and I think it could be for you. So stay positive, be prepared for it, do some homework, and you're gonna recover just fine. All right, guys, thanks.